Dentures are a really big issue in dementia care. I think the same challenges that a lot of older people have with taking care of their dentures and keeping them comfortable and well-fitting, they apply obviously in people living with dementia, but the consequences can be more severe. So if somebody has an ill-fitting denture, then they may not necessarily have the insight or the communication skills to be able to tell somebody, I think that the pain in my mouth is being caused by the denture, and as a result they may live with pain and discomfort caused by that sort of ill-fitting denture for quite a long time, and potentially have much more severe consequences for their gums and than would happen if somebody didn't have dementia and decided to go and see the dentist or tell someone much sooner. So it's really important to try and be as proactive as possible in sensing or identifying whether somebody with dementia has pain associated with their denture or with their mouth in general. In terms of keeping the denture safe and cleanly stored, we recommend doing exactly what would be the case for anybody else, which is to take it out every night and clean it, store it safely in a container. But other than that, I think the main problem that arises with dementia is what happens when that routine is disturbed. So rather than putting the denture into a box in the same place in the sink every single night, what happens if that routine is disturbed when that person has to go and stay somewhere else? A really common example of this is when someone has to go and stay in hospital, and that regular routine is broken up. And also, if they're moved from one ward to another, it's easy for that denture to be lost. So I think one of the really big messages I would like to get out to people with dementia who have a denture is to get it marked with your name and any other identification, so that if you should ever have to go to hospital and you are separated from your denture, then it's much more likely that you'll then be reunited with it, hopefully within a period of a few hours or days, rather than having to wait several weeks or more to get a new denture, during which time you could have real problems, everyday problems of just struggling to eat and speak and having confidence interacting with other people.